Hey, this is Tim Reha, Digital Health Live studio here at Las Vegas CES 2014. We have Mary Kate Foley, VP of User Experience for AthenaHealth. How are you doing?
I'm doing great. Just had a great panel. Yeah. Really got a chance to talk about stickiness and what makes people come back to do the right things for their health.
So you're a designer by parenting almost.
Actually, I was born into a design family and a healthcare family. My mother was a pediatrics nurse, and my dad is a graphic designer and industrial designer. And you couldn't get through a day without talking about a typeface or how the shape of a chair leg or something like that. Yeah.
So what is the effect of design and stickiness?
Well, design is all about human cognition, perception and behavior, and stickiness is behavior. If you want people to come back, you've got to understand what motivates them, you've got to understand how they judge success, and you've got to feed right into that. I mean, we've got all these levers, and design is really about understanding how your target audience is coming to a problem, and both their expressed and their unexpressed needs.
Interesting. How do you measure?
How do you measure stickiness? Well, it depends what problem you're going after. In my space, in AthenaHealth, we provide cloud-based services for medical practices and hospital departments, and then we reach the patient through those practices. So, of course, if you're in a medical practice, you're a captive audience. So stickiness is not measured by page views. What we measure it by is performance. Okay. If we're doing our job right, you're coming back, you're happy about it, and you're doing your work better. For patients, of course, we measure it by, are they getting the care that they deserve, and is their health getting better, or is their health managed?
So what were some of the key points? What was the buzz going on with the panel?
In the the panel was really interesting. We had an interesting mix of people who were more focused on devices, both the industrial design and the software along with that, and then folks who go directly to consumers, folks who are more serving the healthcare delivery side of the house. So I thought we had a really interesting panel with a number of different perspectives. And in fact, I think that's key to understanding digital health. You're not going for a one-size-fits-all. All sorts of different facets. You've got to come at this problem differently and then piece it all together because it all unites in one patient.
It's a tough space to do hardware, software, usability, and make a unified, clean experience and then customized.
Oh yeah, absolutely. And in fact, customized, when you're measuring performance, customization it's not always your friend, right? Because it's expensive, but it's also it's very you don't know what you don't know, right? Even if you practice healthcare, you may not understand the best way, the best kind of support system you need. I'd much rather have my target audience tell me about the problems that they're having and really help me wallow in those problems with them and see if I can solve them without any customization, because customization for them is money and work.
Interesting. So what brings you down here? What are you trying to get out of the whole CES digital health experience?
I just want to keep up with the industry, right? There's so much happening. And of course, in AthenaHealth, we have so many great ideas and we can't do it all ourselves. So to be able to come to CES and see what other people are doing in the digital health space, I'm hoping to find some people that we can bring into the More Disruption Please program that we have. We have a marketplace where you can become part of AthenaNet. And
very cool.
Yeah, very cool.
So where do people do that?
We have a More Disruption Please. More Disruption Please. I want to get that right because it's kind of a funky phrase. More Disruption Please marketplace at AthenaHealth.com.
Okay. And are you on Twitter at all, or how do people connect up with you personally?
People connect up with me personally. I'm a lurker on Twitter. I don't do much posting.
Yeah.
So you can connect with me directly. Just reach out to me. I mean, mostly I like to follow Jonathan Bush on Twitter.
Okay, great. Well, thanks for being on the show.
Yes, thank you.